Hello, my name is Albert Messiha. I'm a student at the NTPD program. Today I'm going to present my patient case. He was referred to me for a comprehensive assessment and treatment plan for certain health issue. My patient name is Peter Lindo. He is 42 years old, white male, who presented to the pharmacy asking for help selecting something over the counter for his uncontrolled cholesterol level. He is concerned that multiple lipid parameters uh, were out of normal range from a lab order that was done for him a week ago. According to the information presented in the case, his social history: he is a current smoker, drinks socially, he is married with one child, he has an employer-based insurance with Blue Cross Blue Shield. His family history: his father is living. His father also suffered heart attack few months ago. His father age is 66 years old. His mother as well is living. She has a history of other cardiovascular disorders as well, like myocardial infarction. In addition, the father is active smoker as well. My assessment for the first health issue, which is the out of range lipid parameters, that he has uncontrolled hyperlipidemia or dyslipidemia according to the labs done to him a week ago. And this is according to the current guideline for the American Heart Association. It was found from his lab work that his cholesterol level was 262, the HDL level was 26, the LDL level was 169, triglyceride 333. His A1C was 5.9, which suggests that he has another health issue. He might be a pre-diabetic patient. I calculated the ASCVD risk factor and it was 20.5%. His weight was 245 pounds. His calculated BMI is 33.2, which put him as an obese patient. The risk factors that might be associated with him having dyslipidemia is he has sedentary lifestyle, he smokes, he's obese, and also he has a family history of cardiovascular disorder. The patient, according to my assessment of the disease and the current therapy plan, he lacks therapy for dyslipidemia, and my plan of treatment, it included a combination of non-pharmacological treatment and pharmacological one as well. For the non-pharmacological treatment, I recommended a healthy diet for the patient, for example, DASH or Mediterranean diet. Also, I recommended exercise and physical activity, which will reduce the risk for future cardiovascular disorder. He can engage in physical activity, and according to the current guideline, the physical activity can be minimal of 150 minutes per week, and he can do moderate intensity to high intensity exercise. For the pharmacological treatment, I would recommend to put him on high intensity statin. For example, I wanted to start him on rosuvastatin, generic for Crestor, 20 milligram oral tablets, direction take one tablet by mouth daily. And it can be during any time of the day. For a follow-up plan, after starting the initial treatment with the statin, I would schedule an appointment after 6 to 12 weeks. Also, after stabilizing the patient on this treatment regimen, I would follow up and schedule a follow-up as well after 12 months. And this is according to the American Heart Association guidelines. I would also monitor during the statin therapy the fasting lipid panel to assess the efficacy of the treatment. Also, I would monitor the LDL level, and as a safety and efficacy monitoring parameter for statins, I would measure the fasting glucose level, the A1C, the liver function parameters, also creatinine kinase if the patient experiences symptoms of muscle pain or muscle symptoms. For the second noted health issue, according to my assessment of the patient case, is the patient has uncontrolled smoking issue. He stated that he smokes the first cigarette about 15 to 20 minutes after waking up with coffee. Also, I found that he smokes around 10 to 15 cigarettes per day. The patient started smoking in his early 90s, in his early 20s, and he has tried 2 times to quit smoking, but unfortunately he wasn't successful. The first time he tried quitting cold turkey, and the second time he used 2 milligram nicotine gum. And I don't think it was adequate strength and dosing for him per current guideline. The patient also lacks education and therapy for smoking cessation, and also he lacks knowledge about the availability of different pharmacological treatment. My treatment plan for this health issue, the smoking issue, is to include a combination of behavioral therapy and pharmacological therapy are recommended for him per current guideline, as this combination produced higher smoking quit rate. I would start him in nicotine 20 milligram batch direction, apply one batch daily for 6 weeks. Then I taper him down to the 14 milligram daily for 2 weeks. Then I would taper him down again to the 7 milligram daily for 2 weeks. Also, I would start him on nicotine gum, but the 4 milligram this time. Direction chew one piece or one gum every 1 to 2 hours for the first 6 weeks, and the gum should be used for 12 weeks with no more than 24 pieces per day. My rationale is according to the guidelines, the nicotine replacement therapy combination is recommended as a first line treatment for smoking cessation. Also, I recommended the nicotine 20 milligram batch as the patient smokes around 10 to 15 cigarettes per day, and it would provide a steady state nicotine level in his body for a long time. And I recommended the nicotine gum 4 milligram as it will help him with the urges. For a follow-up plan, I would schedule a follow-up visit in 2 weeks to monitor for adverse effect and adherence to the medication, also to provide support for smoking cessation. Also, I would educate the patient on how to deal with nicotine withdrawal symptoms such as cravings for cigarettes. Also, I would educate him on the importance of adhering to the medication for higher successful quit plan. Also, I would educate him on how to use the patch and the gum. For example, he should avoid uh, eating or drinking 15 minutes prior to chewing the gum. And for the patch, he needs to apply it to dry, non-hairy skin. And there is other educational tips for this patient as well for smoking cessation. Thank you so much. I really appreciate it.